very much for the invitation. I'm really happy to be here with you today. And I just wanted to start by just the biggest heartfelt thank you to you and your organization, because you may not be aware, but in the lead into the pandemic, I'm sure you'll remember the Ford government planned to cut public health funding dramatically and restructure public health units across the province, going down from 34, I guess, to something like 10, somewhere between 10 and 20. So amalgamations of public health units, and then major funding cuts to public health. And we organized, along with you, in partnership with you, mass rallies. And in Ottawa, we did it at an arena and had thousands of people out. And the municipalities spoke up and others as well. And collectively, we were actually able to significantly roll back those planned cuts to public health and put off the restructuring of public health, the closure of local public health units and the amalgamations of them. And then, of course, the pandemic hit. And the world has completely turned on its side for you in particular, but everyone ever since. You were instrumental in that. And you know, sometimes we don't really celebrate our victories enough, but your union publicized on Facebook through communities in Ottawa, printed leaflets, helped to organize masses of community members, hundreds, to volunteer, to put out the word, helped organize press conferences, and all of that effort kind of culminated in these giant rallies. We did 4 across the province. And then we also connected with mayors and municipal councillors and others to push back against the cuts, and succeeded in getting the Ford government to roll them back. It was amazing work. We learned a lot from you as well about how to do some of the social media organizing. It was really a great effort. And so thank you for all of us, for the amazing work of public health, and for standing up and really forcing the Ford government back on its heels on a key major cut that they were trying to pursue. And the lesson from that is, you know, where we have actually organized mass fightbacks, we actually have won. You know, at least we've held them off from doing the worst. But there's a lot more. And, you know, as we've gone through the pandemic and had this kind of extraordinary experience in healthcare, we are seeing patterns emerge about what this government is trying to do. And repeatedly, the plan is to devolve decision-making and power over organizing healthcare to provider companies, for-profit and not-for-profit, and then privatize the remaining public parts of healthcare. It is extremely disturbing. And so I really just appreciate the invitation to be able to kind of run through it with you. Many of you may remember, maybe, does everyone know how to use the raise hand function? Okay, so do people here remember, can you just raise your hand? Do you remember the Harris government? Are you too young, or some of you remember? So under the Mike Harris government, we had, for the first time really in the history of the country, both at the federal level and at the provincial level, major cuts to the public sphere, you know, public services, et cetera. And then they always go together. Of course, people would never accept privatization if they didn't sort of cut the public service. And then privatization, attempts to privatize various different services. And, you know, mostly we were able to roll them back, but in healthcare, they succeeded in privatizing home care. A very significant proportion of home care. And now the majority of home care services are privatized in Ontario. There have been severe staffing shortages in home care ever since. And of course, the for-profit companies take their profit out of the wages and working conditions of the staff. In healthcare, almost 70% of the costs across the board are staffing. And if you want to make room for profit, then you either do it by reducing the number of services or the equipment, the cleaning supplies and various things like that, reduce the amount of time available for cleaning and those sorts of things, reduce the number of services, or you take it out of the wages and working conditions of the workers in that sector. And so home care has really been in crisis ever since it was privatized. Then they privatized the majority of long-term care. And we saw in the pandemic, in sharp relief, the absolute tragedy that for-profit long-term care has really foisted on this province. In Ottawa, I'll never forget, CBC told a story of a woman, her name was Pierrette, and this was after the military report. So after the military reports that described in visceral terms the quality of living and care that was happening in the long-term care homes where they went in, most of them for profit. So Pierrette, so this is months after that, when things should have been fixed and when PPE should have been available to all the staff and protections in place and so on. Pierrette lived at West End Villa, which is an extended care for-profit chain owned home in Ottawa. And her daughter went in to see her. She had dementia and she had COVID. And her daughter went in to see her, and this was in late September. And there were so few staff that there was feces on her bed, there were feces on the wall. They had been there for a long time, they had dried. She had been left like that. She hadn't been fed. Her lips were, bone dry. Her mouth was bone dry. She had her table for food out in front of her, but with dementia and COVID, she was not able to feed herself or open the containers. She had juice containers, all but one of them unopened, left on the table in front of her, and she was not able to open them and hydrate herself by herself. There were no staff around, and residents were wandering into and out of her room. As I say, she had COVID. She was supposed to be isolated from the other residents, but they were wandering unfettered into and out of her room. And the daughter described the conditions in which her mom was living with utter horror. In the end, Pierrette died. It was September 26th, I believe. Her daughter had been calling the nursing station all morning, trying to find out what was going on with her mother. And sorry, it makes me cry to think about it. She wasn't able to get a hold of anyone. Finally, the nurse phoned at about just before noon and said that she was so busy, she wasn't able to get into Pierrette's room. This is a woman who has COVID, who has dementia, has full care, and was dying. Wasn't able to get into her room till just a few minutes before she called, and that Pierrette was going to pass away. The family raced and they got to Pierrette's side just before she died. And she died in those conditions. And that should just never happen. But it was the culmination of years of lobbying effort by the for-profit long-term care home industry to deregulate. They didn't want minimum care standards, so minimum staffing standards to have enough staff to provide the care. They opposed annual surprise inspections of all of the homes. They hate the surprise inspections, and they had succeeded. When the Ford government came into power, they canceled the surprise inspections of all of the homes. They opposed enforcement. They opposed fines for homes that were routinely non-compliant with the standards, and they had succeeded in that. No home was fined. And even after the military report, Doug Ford was on TV, appeared to cry about the conditions that people were left in, and said no stone would be left unturned, that they would look at criminal charges, they would reinstate the inspections, there would be fines, there would be suspensions of licenses or license revocations for homes that were routinely non-compliant or had just these horrific standards of care and living for the residents for which they were responsible. And none of that happened. In fact, a few months later, upon a lobby of the for-profit long-term care industry, they passed a piece of legislation shielding them from lawsuits for negligence during COVID. So, the opposite of actually holding them accountable. No home has been fined. No criminal charges have been brought for negligence or for the deaths of now, what is it? I mean, thousands of residents in long-term care homes from COVID alone, as well as the ones who died of dehydration and just total failure to provide the care of negligence and neglect. And they have not even reinstated the annual surprise inspections. When for-profit industries take over the ownership and control of providing vital healthcare services, they end up with immense power to lobby for changes in their interest, to deregulate standards, to deregulate enforcement, to make room for profit, to ensure that more public money goes to profit. And that puts them in direct conflict with trying to improve care levels and improve care for people. Having seen that, I swore we would go to the wall to stop this if it ever happened again, and now the Ford government has announced they intend to privatize the hospitals, the core services of our hospitals. Leading into the provincial election, we held 20 press conferences across the province warning that we believed that the government was going to privatize the hospitals. They sent out a communications person from the ministry after us to speak with the local media, and they categorically denied it. They said, and this is almost a direct quote, "We are not expanding the private clinics and hospitals, and we have no intention to do that." 2 months after, that was 2 months before the provincial election. 2 months after the provincial election, they announced their intention to privatize the surgeries and diagnostics, which are the core services from our public hospitals. In January 16th, the Ford government held a press conference and announced, in their words, that they are going to substantially expand the for-profit clinics and hospitals, that they had tendered 3-day hospitals to privatize cataract surgeries, one in Ottawa, one in Waterloo, one in Windsor. And under questioning by the media, the Premier said, Doug Ford said that their assessment is that 50% of the surgeries at our public hospitals are of the easy sort, that they could privatize. That would gut the small and medium-sized hospitals across Ontario. That's most of the services that they have left. And it would certainly be devastating also to the large hospitals. For-profit hospitals and clinics take the profitable patients. They do not do the unprofitable surgeries and diagnostics. So they don't want people who are attached to all kinds of tubes, who can't walk in and out of their clinics. They want the ambulatory patients, the fast, easy, profitable patients, not the ones who have COPD or heart arrhythmias, who have diabetes or other comorbidities, who are medically complex or obese, who have higher risk of coding on the operating room table. So they take the light, easy patients. They also take the funding and the staffing out of the local public hospitals to serve those patients, leaving behind the complex cancer care patients and the other more complex surgeries and patients in the public hospitals with less staff and less funding to provide for them. They also extra bill patients illegally. We have found every private clinic in the country. So I should say the vast majority of hospital services in Ontario are provided by our local public hospitals. Most communities have spent 100 years building their local public hospitals and trying to build up services that are closer to home. The private clinics under the Canada Health Act, which is the major legislation that provides almost like a bill of rights for patients in Canada, says that you cannot charge a patient for a medically needed service, a hospital or physician service. You can't charge for surgery. You cannot charge for diagnostic tests that the patient needs. That's illegal in Canada. And yet we phoned all the private clinics across the country twice, and all of them in Ontario 4 times. And as I say, still the vast majority of surgeries and diagnostics are done in public hospitals, but they have allowed in various provinces private clinics to kind of eat away at the edges of it. And we caught the majority of the private clinics extra billing patients, like charging patients for the surgery and for their diagnostic tests. We also caught them charging for a whole array of medically unnecessary add-ons. In Ontario, we don't have private hip and knee surgery clinics and things like that at this point, but we do have private cataract surgery clinics. They're common. And so you may have relatives who've had this themselves. You go to a private clinic and you're told that the cataract surgery will cost $2,000. That's routine now for the surgery in the private clinics. That's illegal. You can't charge for cataract surgery under the Canada Health Act and under Ontario law. They also tell patients that they need medically unnecessary eye measurement tests, $200. You know, they need special lenses, corrective vision lenses, and so on and so forth. And they charge thousands of dollars for those. And at the end of the day, the surgery itself under OHIP is $500. You know, to charge $2,000 is ludicrous price. It's 4 times the price. It's illegal to charge the patient for that. And you can't manipulate a patient into paying for medically unnecessary stuff, pretending it's medically necessary in order to make more profit. But it's absolutely routine in the private clinics. And so we're warning, if you transfer the ownership and control now of the public hospitals in Ontario to private for-profit clinics and hospitals, we will lose single-tier Medicare in this country and in this province. We won't be able to protect it. No province has privatized those services and been able to stop the private clinics from extra billing the patients. It's what they do. And if you think about it, if you have 1,000 patients and you charge $200 each for an extra eye measurement test, that's $200,000 of an additional income per year. If you charge $2,000 for their surgery, it's $2 million of extra income per year. And that is exactly why it's happening. It's incredibly lucrative and the prices are astronomical. I spoke with a farmer in Saskatchewan a few weeks ago who was told that his wait for a hip surgery, so he's, you know, farmer and he's aging and he now needs to use a walker. He's in pain all the time. You know, he has his dignity. He doesn't want to be in that situation. He wants to be able to move around and so on. He's looking for his surgery. It's probably even untrue that he has to wait 2 years to get it in the public system because they often exaggerate the wait times and people are now attuned to believing that in Canada. But he was told at the private clinic that he could go to Calgary and get the surgery, $50,000 for a day surgery, hip replacement surgery in Canada. That is completely illegal. It's an unbelievable price. You know, in a public hospital, it would be $5,000 or less for that surgery. And now he's fundraising in Canada for his hip replacement surgery. That is completely against what Canadians hold as our core values, that we would provide healthcare for everyone based on their medical need and not based on their wealth. And so we're warning, based on the evidence, that if we allow the privatization of our hospitals, it will pose as a fatal threat to the core values of public Medicare in this province and this country. So our challenge now is how to stop them for privatizing, from privatizing our hospitals. So we came up with a plan. You know, they have no mandate. Nobody went to an election and said, we want to privatize the hospitals, vote on it. So we said, well, you know, we're going to institute some democracy in this debate. And so we've called a province-wide referendum. That's like a citizen called referendum. And in every community, we want to get voting stations outside the grocery stores, outside the drugstores, outside busy coffee shops, and everywhere in the community that we can. In Ottawa, we're aiming for 100 voting stations across the city, and they'll be staffed by volunteers with ballot boxes. We have leaflets that we'll be distributing. They look like this across the province. They have a window poster inside. We have lawn signs and poster and car decals. And the idea is to publicize widely in every possible way that we can. So people taking leaflets, I'm gonna, go door to door in my neighborhood and to every community group that I'm involved in and pass out leaflets. They'll have lists of voting stations inside them. The vote will be May 26th and 27th. That's a Friday, Saturday, busy shopping days. It's the weekend after the long weekend in May. The 22nd, Monday, the 22nd is the statutory holiday. And then we'll announce the results on the Tuesday after, and people will drive in the ballots to Queen's Park, and we're aiming for 1 million votes to stop the privatization of the hospitals. Just to put it in context, a large petition in Ontario would be 20,000 to 30,000 signatures. Nobody ever gets 1 million people to do one thing at the same time in terms of, advocacy. And so that would rock any government of any political stripe if we can succeed in doing it. And we're kind of well on our way. April the 18th, we'll announce publicly in press conferences across Ontario, and we hope that you'll join in Ottawa and across the area where you live. All of the communities in Southeastern Ontario where we have contacts are joining in, and we're asking for other volunteers to help leaflet and spread the word, to volunteer at voting stations for a few hours, to help collect ballots, to do votes in their workplaces. And if you don't mind, I just have a 3-minute video to show you kind of what it looks like. We did this before on a very small scale. The government was bringing in a model of privatization, was called public-private partnerships, PPP or P3. And it was kind of a halfway, measure to sort of halfway to the full privatization of hospital services. And so we held referendums in 8 communities, and we got 198,000 votes in those communities to stop the P3 hospitals. And at the time it was the Liberal government. And so they were calling me at the end and they were saying, what's it going to take to get you to go? We know you're never going to go to green light on this, but what's it going to take to get you to go from red light to orange light, And in the end, they rolled back the privatization in the P3s so that at the beginning, the first 2, the Royal Ottawa Hospital and the Brampton Hospital, half of the hospital budget for 30 years was caught up in the contracts with the private for-profit companies, about 400 jobs. By the end of it, about less than a dozen jobs per project are privatized, and they have scaled back really dramatically the scope of privatization in the deals. So we were, like our fight back on public health cuts, we were, didn't get it all the way, but we pushed the ball down the field a very significant amount of the way, and we're able to roll them back. So with your okay, and before we move to questions and so on, I just wanted to show you a quick video of what it looks like, so you have a mental picture of what we're trying to plan and what we wanted to ask you if you wanted to be involved in. Is that okay? Okay, so I'm going to share my screen. This is from the Kingston referendum on the P3 hospitals, and you'll see what it looks like. We called it a plebiscite. We're just going to call it a referendum this time because it's easier for people to understand. So here, oopsie, I forgot. I have to optimize the sound. 1 sec. Okay, here it is.
This looks very much like an election campaign, except it's not. It's a plebiscite vote that's actually citizen-run, not government-run. It's put together by the Ontario Health Coalition, asking citizens if they want a public or private hospital.
Well, the drivers have extra ballots, so if they need more, like if they've run out in their trucks, then I will let them know you guys have some extra. The phone's been nonstop. People are interested. They want to learn more. They've been very supportive of the campaign. We've had very little people coming in upset about what we're doing.
Well, we're holding a community-wide plebiscite, which is a community-wide vote, like a referendum, only it's organized by a citizens group, by the Kingston Health Coalition, about the future of the new hospital in Kingston, whether it's going to be a public, not-for-profit hospital, or whether it'll be built as a P3, privatized P3 hospital with 30-year-long contracts with a private for-profit multinational consortium.
Some people wonder how this affects health care. They say, well, the healthcare system remains public because nurses and doctors will be paid by the government. But the model of the P3 hospital is a step in quite a dangerous direction.
Some of the more conservative members of council have tried to argue that we shouldn't have any role in it as municipal councillors because it's a provincial issue.
So we're very concerned in the city of Kingston about where is the money from our property taxpayers going, and it turns out that it's going to fund a consortium that over time will make 12% on their invested money. So that 12% is, part of that 12% is coming from our property taxpayers.
It's been really positive. It's actually really cool. People are pretty excited, especially when they hear that there's 180 other volunteers out there on the ground doing this as well. It's just such an incredible feeling of solidarity. Everybody, even though they've been out there in the cold for an 8-hour day, they have no problem doing it. They're having fun and having a great time.
It's been very hectic, super hectic. We had 3 volunteers here for most of the day, and we barely had a chance to have a drink of coffee, and we're right here in Tim Hortons, so that just goes to tell you how busy we've been.
All the businesses have just been so warming and welcome to allow us to be able to set up these poles. It's been a great commitment by the businesses here in Kingston.
It was a huge victory, and you talk to people on the street, everybody knows what's happening. It's now become a public issue, and it wasn't 2 months ago. Nobody even knew we were getting a new hospital. So we've elevated the debate and the public sort of discussion and the democracy around this healthcare policy to a level which is phenomenal. That's the value in a sense of validating that whole discussion, all that work that was done. And then as the next step forward, we're going to be able to say to the government and the politicians, this community really cares. We want a public health care system.
So that's what it looks like. It's really amazing. And by the end of it, we should be in a position where people all across Ontario know this is happening. They have some kind of way that hopefully is meaningful to help try and stop it. And we get a chance to, with a deadline, to do kind of mass community education and outreach and mobilize people to stand up to protect their public hospitals. I just want to end by saying, in this country, we have spent 70 years building a public healthcare system that provides care for everyone based on their medical need, and is unlike, in the United States, where wealth absolutely does determine whether or not you get quality healthcare. We've spent 100 years or more in most communities, hundreds of communities across Ontario, building our local public hospitals. People have volunteered, they've donated, they've given from payroll deductions to build those local public hospitals. Virtually every hospital in the province has operating rooms that are not used for weeks, months, even permanently closed because of lack of funding. We have most operating rooms in Ontario operate from 8 a.m. to 4 p.m. and then are closed. They're closed on weekends. We have the capacity, if they were funded and staffed, to provide the services. We don't need to build at public cost, a whole new system, but this time owned by for-profit companies to privatize those services. And my fear is, if they succeed in doing it, I don't know how we'll ever get them out again. So we have to do everything possible to protect those core values that underlie our public healthcare system. It's been the honor of my life to do this work, and I really hope that you're able to join in any way you can. I see people volunteering in the chat. Thank you so much. There's just something that everyone can do. It's quite simple, really. workplace votes, helping to leaflet, and the workplace votes will run through May, helping to leaflet and publicize in the community, sharing social media and emails and those sorts of things, volunteering at voting stations, helping to count the votes in the end, and announce the results. There's just, we're not asking anyone to do all of it, but, if we have 10,000 volunteers across Ontario, each doing pieces of it, we will be able to get to 1 million votes, and we will be able to mount the kind of public pressure that works to change public policy in the public interest. And so thank you so much for inviting me. I hope that you're able to join in, and I hope this is helpful.
Natalie, thank you so much. Let's all just take a moment. You can turn your camera on or your audio on, or use an emoticon if you want, or a reaction, just to say thank you so much for your time and for the work that the Ontario Health Coalition does. It's so great for us to be so informed, and it's so heartening to know that we can fight back and we can win. Before we go to questions, I just want to encourage folks, and I want to let folks know that CIPP will be participating in this Ontario Health Coalition campaign, and we need members involved. So go ahead and indicate in the chat if you'd like to be involved. Make sure your full name is there, and I will let you know what activity CIPP is participating in as a group, and we can all go out together. Of course, you can always just get involved directly with the Ontario Health Coalition yourself, and they'll offer you opportunities, but CIPP will be there as a union that represents many healthcare members. And we will be in touch by email about that, but now is a great opportunity to indicate in the chat with your full name that you'd like to be involved. And we just have a few minutes left. So for people who have questions, please go ahead and just raise your hand, if your actual hand, if you want, or use the raised hand reaction on the bottom, and we'll take just get folks to ask your questions right out loud. Or if you want, go ahead and put your questions in the chat, and I will ask you for them. I'm so happy to see some names coming up in the chat. I think it's going to be exciting to build a CIPP team that's working to back up the great work of the Ontario Health Coalition and to stand up for public health care. So any questions, folks?
I think there was one about the actual cost of the surgery somewhere in the chat. I just saw it go by. And thank you. Look at this. It's so exciting.
Yes. You're right, Natalie. Brad Bellows asked, what is the true cost of these surgeries and how much is subsidized by the government?
Yeah, it's hard to know, cataract surgery for one, the technology has changed over the years. So now cataract surgery is literally a 7-minute surgery, but the physicians who do it, the surgeons, are paid $500 per surgery. And so you can see a high volume cataract surgical center is very lucrative indeed. And then, as I say, they're charging $2,000 per eye in the private clinics, plus add-ons, diagnostic tests, and so on. The actual value of the surgery is hard to determine because they negotiate with the Ontario Medical Association, which is kind of the union for doctors, the prices of the various, different procedures and so on. Without question, the private clinic, and I think you got this, but the private clinic prices are, often 4 or 5 times the cost in the public system. Like for an MRI in a private clinic, they start at $1,000. When the province ramps up the number of MRIs they do in the public hospitals, which is just expanding the hours that they run the machines, which means staff, right? It's $280 to $350 on average, not starting costs for an MRI. So, again, 4 times more expensive. The hip and knee surgeries, they've just gone through the roof in the private clinics. But the actual cost, it's based on what they negotiate with the Ontario Medical Association for the fee schedule.
Thanks, Natalie. We have a question in the chat from Whitney Chase asking, do we go to the website to find where the polling stations would be?
Yeah, so the sort of timeline is this. We're going to announce publicly the referendum. So in press conferences across Ontario, you have an amazing local health coalition in Ottawa. There are also local coalitions in Perth and Cornwall, in Kingston, and then key contacts in all the towns in between, and Renfrew as well. And so all of them will be holding press conferences on April 18th to announce. At that point, we'll announce the dates, the ballot question, and who can vote, which is anyone 16 or over, because they'll all be of voting age in the next election and it's their future. So that's what we decided to do. And then the hard deadline to get all of the voting stations. So the local coalitions and all the volunteers are out right now asking stores and things, can we have a voting station outside your store on May 26th and 27th? Legions, you know, all kinds of places, busy places in the community. The hard deadline to get all of them is April the 28th, because we'll announce all the voting stations May 2nd. Workplace votes will happen after May 2nd through the month of May, whenever it's possible for people to do it. And I figure in some workplaces, it'll be one day, some workplaces it'll take, you know, a few weeks, and there'll be different systems for doing that. And so we're asking people to work with the local coalitions to get the materials, ballots, they have to sign out and sign back in ballots, and, you know, all of those things, so that people can't just mass produce ballots and stuff ballot boxes across the province. And there'll be online voting as well. And so as of May 2nd, that list of all the voting stations will be up on the website, and it'll be in inserts in every leaflet that is distributed through the community. And then if we can afford it, we'll buy an insert in the local, like where there are local newspapers or penny savers that go to every household, we'll buy an insert listing all the voting stations in that region. We're just kind of raising money to, we have to be able to pay for all this. So whatever we're able to, you know, we'll make it as big as we can pay, you know, afford to do.
Wonderful. Thank you, Natalie. Any other last questions, folks? And last, of course, if you didn't put your name, if you're interested in being involved, now's a great opportunity to put your name in the chat. Otherwise, you'll be hearing from us about the ways that CIPP will be participating in the Health Coalition campaign. And I just want to thank you all for joining us so much today. Of course, as community members and people who live in Ontario, we're directly impacted by the changes to the public healthcare system. But even more so, as members of a union, we have many nurses in our union who work in the long-term care sector, many nurses who work in Ottawa Public Health, we have paramedics. And so what happens as the government starts to change the standard of care across the province, drive down the wages of those workers, that's going to impact all of those members, all of us across the sector. So it impacts us as people who live in Ontario, but specifically as folks who work in the public healthcare system. And then beyond that, as a union that represents public servants, as sort of the arguments for privatization grow and as it becomes normalized, then our work fighting against outsourcing across the public sector or the use of the P3 model becomes even harder. And we've seen in our own community, in the transit sector, P3 projects don't work. They don't work across the province. And so anything that moves us in that direction is a problem for us as a union. So as community members, union members, and folks that work in the public health care sector, this is super important for us. So I'm so glad that we're building a team that can be active on this. So thank you, everyone. Thank you,
we
Natalie.
love you. Your union has been real leaders in this, really, truly. I mean that sincerely. And just thank you. Thanks. You're amazing.
Thank you, Natalie. Thank you all for being here. Have a great day.
Bye.